Good afternoon, everyone, and welcome to the Multicultural Health Media Conference online with Minister for Multiculturalism, Natalie Ward, and Dr. Jan, Senior Medical Advisor for New South Wales Health. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communications Service. On behalf of New South Wales Health and Multicultural New South Wales, welcome and thank you for being here today. We'd also like to acknowledge the traditional owners of the land of where we are today, of the Eora Nation, and also pay respects to past, present, and future. Thank you so much. We also want to acknowledge the traditional owners or the elders of multicultural communities for those who are present today. Minister Ward, would you like to start off?
Thank you so much, Jesusa, and thank you everybody again for attending our very important weekly forum. I also acknowledge the traditional custodians of each of the lands and waters on which we meet and pay my respects to elders past and present. For me, that's the Gayamagul people, and I thank them. I'd like to highlight again today how important you all are in promoting our critical public health messages, including the stay-at-home message, and the very important message about getting vaccinated. We just cannot emphasise that enough. We know that many multicultural communities are doing it really tough during this pandemic. And that's why today I'm delighted to announce that more than 150 community organisations are the successful recipients of a $750,000 New South Wales government funding package to deliver support for vulnerable people in our multicultural communities during the COVID-19 pandemic. The Stronger Together Grants program includes support for programs including delivering food hampers and essential items such as face masks to those in need. In addition, the package delivers increased mental health support, such as regular wellness and psychological check-ins over the phone for our seniors with multicultural backgrounds. The package also provides transport for vulnerable people with limited mobility to access essential services, such as medical appointments, including vaccination appointments, and essential grocery shopping. The New South Wales Government is responding to the rapidly evolving pandemic, and supporting these kinds of programs are a crucial part of that. I'm also happy to say that the daily COVID update press conferences are now being translated in 4 languages, live and as it happens, in Arabic, Vietnamese, and now Mandarin and Assyrian. And I pass on our thanks for the New South Wales Government's partnership with SBS and all our multicultural media outlets. I'd like to remind you that applications for our Multicultural Media Grants program close on Friday, and I encourage you to apply. There's $2 million available, and we want to hear your ideas about how best to get this important health information and our messages across. You know your communities best, and we're so grateful to partner with you to get that information out there. Finally, can I please ask you to promote the federal census, which is happening next Tuesday, the 10th of August, with your audiences and across your networks. The census is coordinated by the federal government. It's so important that all members of our community complete the census so that we have a full understanding of the makeup of our diverse society in New South Wales. This data is invaluable for government, and it informs everything we do to serve our community, including our future policy making. So with that, I'll thank you, and very happy to be here again today. And again, my sincere grateful thanks to each and every one of you for the wonderful work that you're doing in conveying all of these messages. Thank you.
Thank you, Minister Ward, and thank you as well for all the hard work that you're doing. Dr. Jan, what are the current updates that we need to remember today?
So we were in New South Wales, we recorded 233 cases in the 24 hours to 8 p.m. last night. At least 47 of those people were infectious in the community. So that means that they had the opportunity to pass it on as they went to work, as they went to the shops, as they went out into the community. So please, this is why even if people don't think they're going out very often, we are asking everyone to stay at home. Sadly, a man in his 20s and a woman in her 80s both died from COVID-19, showing again that COVID is dangerous not just to the older people, but to the young people, and our condolences are with those families during these must be most terrifying and awful times. It's so important for our elderly community to get vaccinated. I know many people have been trying to wait and hope that they would have Pfizer. It's not the time to wait. It is the time to roll up your sleeve and have the first vaccine available to you. Waiting could have terrible consequences at this time. And so for all of you, please encourage your community to get vaccinated. Some of the things that gives me comfort at the moment is that my 90-year-old mother has had both of her doses of AstraZeneca. So as she receives care into the home, I know that even if the person providing care may not have been vaccinated yet, at least she has that protection. So please do encourage older members of the community to have that vaccine. We've also had detections in the sewage. So we look for genetic fragments of the virus in the poo of people in different areas of New South Wales. And we've detected genetic fragments of the virus in Newcastle, particularly around the Lake Macquarie and Shortland areas, in Mudgee, in Coffs Harbour and in Ballina. So it's a reminder to all of us, no matter where we are in New South Wales, that we need to be careful. But please, we need to encourage each other. If you have even the mildest of symptoms, if a friend or colleague even mentions that they have a bit of a sniffle or they're feeling a bit under the weather, please, we need to encourage each other to keep getting tested. Even if we had a test last week, even if we had a test 3 days ago, if we have new symptoms, we need to get tested each time. It's also important to remember that if you do have those symptoms and you get a test, that you need to head directly home and try and shut yourself away from the world. I know it's quite hard for many of us, but it's so important that we don't stop at the shops, we don't stop at the chemist, that we leave that to other members of our family who have no symptoms, or we leave it to people outside of our household who have no symptoms to do that and drop it to us. It's also important that we remember that as hard as it is, as the lockdown keeps going on, it's much harder for us to not be with our family and friends, and people are finding creative suggestions to say, wouldn't it be okay if we just did this? It's so important that we listen to the rules and rather than our hearts in this situation. It is so important because we see this COVID, it goes with one person to the next household, and spreads through a family. And so instead of maybe one person being impacted and the family being worried for them, we have the whole extended family impacted. And that's a terrible situation for that family. So please do remind people just to stay home, and home means that building where the people who usually sleep there for the night are there each day, not who you visit, who you see regularly and who you'd normally spend time with. Thank you.
Thank you, Dr. Jan. I think that's really important to remember that when you're traveling from one place to another, that is what's going to cause any problems. And LGAs, you're not supposed to travel.
That's right. And I think that's the key thing is COVID travels with us. We're the ones who give it the opportunity to go to our friends, to our families and our colleagues. So if we don't want to give COVID that opportunity to spread, because it will take any opportunity we give it, that's when we need to try and protect each other, show our love for each other, in fact, by instead of doing what we'd normally do to show love, which is to go to somebody and be with them, it's to actually show love and say, I understand why you can't be here.
Thank you, Dr. Jan. We have some questions. Just want to remind everyone to please stay on mute as we only have a few, we don't have an hour. We only have less than 30 minutes for questions. Please share them in the chat and we'll try to get through to them as soon as possible. We have a question here from Violi Calvert from Radio Tagumpay. Thank you so much for everyone who's sending through their questions. Minister Ward, for the sake of mental health, should the Premier and health officials consider allowing in groups of only 2, like for exercise, to sit down outdoors on a lovely day to eat the takeaway food, with social distancing being observed or adhered to?
Thank you for the question. Our government acknowledges the impact of restrictions on people's mental health. There's no doubt there is an effect, particularly on the most vulnerable members of our community. One way we've looked to counter this is by introducing the singles bubble to help people stave off these feelings of isolation and loneliness. We as a government will always follow the health advice, and it's by all of us working together and helping to keep each other safe that we can find that pathway forward. Dr. Jan probably has something to add to that, and I do welcome the question, but I do think that we need to stick to that advice first and foremost.
And I think the hard thing for all of us is that sitting down outdoors with a colleague is one of the joys of life. But at the moment, when we take our masks off, we'll often be talking face to face. And even with our social distancing, the Delta virus hasn't been very respectful of social distancing, to be perfectly honest. And so it gives the virus more of a chance to spread when we're sitting down and talking to each other, and particularly when we're eating, because eating means our masks are off. So you'll see Jess and I have our masks off at the moment. Our masks are usually stuck to our face while we're here in the building. It's just so that if people can't lip read, they can actually see our faces and get that context of what we're saying. But normally our masks are on, and that's the same thing. It's really hard to share a meal with people at the moment, because if you share a meal with someone who's from outside your household, it means that you've got your mask off, and we really don't want that.
Yes. And Dr. Jan, that means when you said don't visit anyone, that means don't have a coffee, don't have outdoor visiting with other people and your friends.
That's the hard thing. We're sort of saying, yes, you can meet someone to exercise with them. And in the singles bubble, you've got a friend that you could even go a little way to exercise with. But really, it's so important that we don't sort of have lunch with our colleague, have afternoon tea with a different colleague, have coffee with a different colleague, because each one of those interactions is a chance for COVID to go from one person to the next. And so even though it sounds awful, it's really important that we don't give COVID that opportunity.
And Dr. Chant today also said in the morning press conference that to stay away from places as well and be careful what you touch.
And I think that's the hard part for all of us, because, you know, you sort of sit in the sun with a member from your household, that's fine. But the other thing is, in my community, I know a lot of the people who live in the next street. I know a lot of the young people who live around, because, you know, either my son's grown up with them. And so a trip to the park shouldn't be a social event, but it can very quickly turn into a social event. So we've got to be really mindful that we're trying not to have households mixing and blending at the moment. And so even if we do go out to the park to exercise, that we try and remember just to wave to people and keep moving, not to actually stop and have a good chat, which is what so many of us would like to do.
Thank you, Dr. Jan. A question from Fred Zhang from Sydney today. New South Wales has been in lockdown for a month, but according to yesterday's figures, we still have dozens of active cases who were infectious when they were in the community. How could this happen when we are in lockdown? And does this mean we need a harsher lockdown, for example, a ring of steel like the Victorians did? Minister Ward?
Thank you so much. It's a great question. Again, I acknowledge the risks, but I need to reiterate that the New South Wales government will always follow the health advice. We very much look forward to the day when our restrictions can be loosened. I particularly, with teenagers at home, I absolutely agree that we should get out there as soon as we can, but we're very mindful of the health advice first and foremost. We've already put in place some of extremely restrictive lockdown measures, including that people in those hotspot areas are not allowed to travel more than 5 kilometres from their home. Because we know most transmission is actually happening at work sites or in the home. So that won't be alleviated by the ring of steel approach. So the best thing we can do is stay at home in our own homes, get the vaccination and follow the health orders until we get through this. Dr. Jan might have more to add to that though.
And I think the other thing is that we're constantly aware that no matter how harsh you make something, people still need food, they still need clothes, they still may need a heater. And so it's very important that not everyone has internet shopping, not everyone can click and collect. So we need to make sure that people are still supported in getting their necessities day to day. And, you know, again, we're discouraging anyone from doing any frivolous. You're not allowed to browse, you're not allowed to wander around. It really is about doing in and out.
Yes, Dr. Jan, as you said, you can deliver heaters and things like that. As long as it's an emergency and it's considered an emergency, that's possible.
This is the thing. If you've got someone who can do this for you, if you're older and you don't feel safe going out, the key thing is that they drop it at your door. No one goes into your house. They drop it at your door. And as tempting as it is to go and spend time with that person, it's important that, you know, you pick up the phone and talk to them while you're waving from out the front of the house, rather than going in, seeing them, looking after them. Trying to minimise that contact between households is what will really help us reduce this spread, and has been helping us reduce this spread.
There's this question from Mervat. Can we send cooked food to others as a delivery only? So as what Dr. Jan said, leave it at the door.
Leave it at the door. And again, try and make sure, though, that you've also managed all those food safety things around cooked food, and made sure that you've temperature monitored things and made sure that it's safe and that people know how to reheat it safely as well. So we don't want people accidentally taking food poisoning with the food they're cooking, because I'm sure people are being very careful, but just again, making sure that people have got good instructions on to reheat things so that it's good and safe for them.
Thank you, Dr. Jan. Dimitri Kalios, or from Greek Australian newspaper Neos Cosmos, has a question for Minister Ward. Last week, the Premier announced plans for getting Year 12 students back face-to-face learning by Monday, August 16th, with HSC trials to commence August 18th. There are a lot of independent schools which mostly identify with one community, like the Greek Orthodox colleges, two of which are in the 8 registered or restricted LGAs. What assurances can the government give to these schools who are still not sure of how effective the COVID-safe protocols will be? Minister Ward?
Yes, thank you so much, Jesusa. I know exactly how it feels. I have a son doing his HSC right now. So I understand the importance of us being clear about this. When Year 12 students go back on the 16th of August, it will be under extremely restricted settings. It'll be similar to last year, but we're dealing with a much more contagious version of the virus. It won't be the normal school environment. So schools will operate under staggered times, and they'll use the entire school space to spread out. Any Year 12 student studying or living in those 8 restricted LGAs is eligible to get the Pfizer vaccination, and we encourage them to do so. The best thing they can do is get that Pfizer vaccination, that it is available to them, and we will make sure specifically that they get that so that they can go back to school. There'll be clearer guidelines available for schools by early next week, but I have spoken with the Education Minister about this, and we're very keen to ensure that all those HSC students do get the opportunity to complete what they have done so far this year, and I know more than anyone how much work has been put in. Should the schools have any questions, they can contact Health if they need more advice on how specifically to run a COVID-safe environment. So I encourage you to contact Health if you have specific questions around that.
Thank you, Minister Ward. There is a question from Narjis Banu. We're receiving mixed information on Astra vaccine from our GPs. We think GPs should give consistent advices and information. It can minimize fears against AstraZeneca, the vaccine. Dr. Jan, what do you think?
There's clear guidance for all medical practitioners in Australia. It's come from our technical advisory group on immunisation, and they are giving advice without fear and without pressure. They're giving the advice whether we like it or not. The advice in Greater Sydney and in New South Wales is, unless you have had a very rare medical condition, you are safe to have the AstraZeneca vaccine if you're over 18, particularly in the outbreak situation we are now. And it's very important that people understand that any advice people may have had before we had COVID prevalent in the community, they should go back to their GP and have that conversation again. Because I know some GPs have previously said to people, wait for Pfizer, or Pfizer would be better. But at the moment, when there's an outbreak in our community, there's a real and present danger for people being told to wait for Pfizer. And so that GP and that patient need to have that conversation again in the changed context of having a COVID outbreak, and with clear guidance from the technical and advisory group on immunisation that it is appropriate to have that discussion with people over the age of 18. So the advice to GPs is clear, but it has changed. And so that's why I think people would be helped by having that conversation over again with their GPs.
Thank you. Dr. Jan, is there an ETA for additional languages to be translated for the daily press conferences? This is from Karen. Minister Ward, we have 4 languages at this point. How many languages are we expecting?
We're working on as many as we can, as quickly as we can. It's really important that we get our messages out in language, and I want to thank each and every one of you for the incredible work you've done so far in getting those health messages out to each of our communities in language. We absolutely appreciate and support you in doing so, and know that it's best going to communities in language. It's just, I'm delighted that we have the 4 languages being translated live, because that means the information is straight out there, and it means that that can be conveyed throughout those communities. We're always looking for the potential to expand, and I'm so grateful that it's been used by so many in the community, and we'll continue to do so. There's also the links on the websites, newsouthwales.gov.au and the health website, where there's translations of the health messages every single day. So it's there and available, but we're very grateful for the cutting edge, first in Australia, of our live translations, and thanks to SBS and our translators, our very hardworking translators, doing all of that work.
Thank you, Minister Ward. There is another question here. For Year 12 students, does that mean that they can book in for vaccination appointment through any Pfizer clinic? Will they be prioritized given that they are meant to be back at school in the coming weeks? Dr. Jan?
So for the Year 12 students, you'll be given information through your school as to how to book those appointments. They'll be at the Kudos Bank Arena at Homebush on certain dates next week, I think they are. So it's really important that you follow the advice from your school regarding your eligibility and how to book those appointments. And again, we'd really ask that people, if there's a link, if there's anything else, don't share it outside the people who really, really need it. The reason why it's a Pfizer clinic is Pfizer is licensed for people 16 and over. AstraZeneca is for people 18 and over. And so that's why Pfizer is being offered, because it recognises the fact that there are many, many HSC students sitting their exams this year who are 16 and 17, not just 18.
Thank you, Dr. Jan. Another question here for Minister Ward. Media reports today claim that Sydney's western suburbs are among those with a lower number of vaccinations. Given that many multicultural communities reside in Sydney's west, is it possible for the data to reveal the percentages of vaccinations of separate ethnic groups? And if yes, can those figures be released in order to inform those groups who are not vaccinating?
Thank you very much. Yes, the federal government manages the geographic data around the vaccine take-up, and I would just say that no matter where you're from or what your background or ethnicity is, we encourage everyone to get vaccinated. Just please don't hesitate. Please get out there and get vaccinated. It is the best protection for you and, importantly, your loved ones. This is what will give us our pathway forward. This is what our path to freedom looks like, is everyone getting the vaccination. As the Premier said, August is the month to get vaccinated. My son is enrolled, and my husband and I have both had our jabs, as has my mum, and I'm really pleased that we've all got that. I feel much safer for doing so, still observing, of course, all the other health advice. But across the New South Wales government, we're working closely with our multicultural communities to encourage vaccinations. And I just want to say again, I'm deeply grateful to all of you who have been such important messengers and partnering with us in delivering this critical message. Please get out there, get the vaccination, and we will find our pathway to freedom.
Thank you, Minister Ward. There's a question here from Ilanka, who says that he operates as a website in New South Wales. We receive media translations in Tamil language, but not in Sinhala language in certain instances. What plans are there to send transactions in both languages, given the majority of Sri Lankan community speaks Sinhalese and Sinhala language as well? And I think this is regarding the media COVID-19 key points that we receive. And I think we are sending out and trying to do as many languages as we can. Minister Ward, would you like to comment?
Yeah, absolutely. I'll take that feedback on board. I very much appreciate that. We are working as quickly as we can, as I say, on the live translations, but certainly the health messages daily are translated. But I'll absolutely take that specific question and take that back with me. Thank you. And I'll look into any of these suggestions. That's why I'm so grateful for this opportunity to have these questions one-on-one. It's really important that we hear from you about what your suggestions are and what your feedback is on the ground. So thank you.
Thank you, Minister Ward. Dr. Jan, how can people register? There's eligibility checker. They can use that and they go to their GPs.
Basically, the eligibility checker will tell you which vaccine you're eligible for, and includes the are you willing to consider AstraZeneca question. So the eligibility checker is there. It's on the Commonwealth website. It's now been translated into a number of languages, and then it will take you through to booking systems. The booking systems are not always translated. They're not always easy. And the other way you can do it is going to hotdoc.com, which also has a list of the of the places that are booking through the hot doc system for vaccinations. The key thing is people are often finding that if they have a vaccination champion in their family or in their community who gets to know the system really well, they become the person who can sort of find those appointments for their family members because they've got a bit of time and they can do it. We should be better. We will be better. But while we're still building the airplane while we're flying it, I think is the thing we sometimes hear, it's so important that we look at the other opportunities we can take. And one of the great opportunities we can take is by having a family or a community champion who will be the person who finds those bookings for your family members.
Thank you very much, Dr. Jan. There's another question here from Bangladesh language. It is important for us to use community radio stations, broadcasters to disseminate information in different languages. Minister Ward, would you like to comment?
Yes, I absolutely agree. In fact, it's critical. I would say it's one of the most important things that we need to be doing right now. And we have recognised that. We've put $2 million into media grants, and we've announced an additional $2 million to be shared between all of our multicultural media outlets. It's absolutely critical that you get those messages on behalf of health out to those communities. Applications do close this Friday, the 6th of August, so we want to make sure we get that money out to you as quickly as possible. That's why it's closing this week, so that we can get that straight out to you. I encourage everybody to apply. The maximum per outlet is $50,000 between the 2 million, and there's criteria, of course, that you need to meet to do that, but please look at Multicultural New South Wales website. The information's there. It's really easy to apply, and I've asked the agency to do that very quickly and easily so that we can get that to you, so you can continue to get that messaging out to community in language. And I just want to thank you again. It is absolutely critical, and the Premier has asked me to particularly recognise and thank you for your important work.
Thank you, Minister Ward. Here's another question from Marcella. I'm wondering if there have been any considerations in changing the terminology from social distancing to physical distancing. There's some research on the implication of language, particularly when we need people to keep as socially connected as possible.
Yes, and I think this is one of the things that we've been having some debate over. We've been socially distanced, then we're physically distanced, and now we're back to socially distancing again. I think with Delta, social distance is actually probably a reasonable word to use, because 1.5 metres just doesn't cut it with Delta. It actually does mean that we do actually have to physically and socially separate from household to household. It's so important, though, that we do keep in touch, that we do keep talking to each other, that we do keep supporting each other. But that social distance, which is something that previously we wouldn't have worried about quite so much, is something that is absolutely key to reducing the transmission of Delta.
Thank you, Dr. Jan. And Delta is a different kind of variant.
That's it. And so it's about 10 times more infectious. People have about 1,000 times more viral particles than they had with the original strain of COVID. And so staying 1.5 metres, I could be pretty confident just previously that with us being 1.5 metres apart, there was very little risk that you would catch COVID from me with one of the original strains of COVID. But if I had COVID now and we would have been talking like this, then there's a very good chance, if we weren't both vaccinated, that I could be giving you COVID right now. So if I was infected, I'm not. So it's really important that people do understand that everything has changed with Delta. Things that would be sufficient protection against COVID from last year are not sufficient with Delta, and that's why we're being so reminding people about the households, because the household is where we're finding that somebody has infected their household by the time that they even had the first sniffle, and they may have taken it to a second household even during that time. And then that second household takes it to a new workplace that takes it to another 10 households, and so it goes on. So sometimes people wonder, why are the restrictions so harsh? And the answer is because COVID is sneaky and it goes with us wherever we go, and without actually really emphasising that don't just hop in to see your mum, don't just go and see your sister's new baby. It's really hard for all of us, but it's so important that we stick to those rules.
Thank you, Dr. Jan. And that means that this is just an indication where apartment blocks are getting cases.
And this is it. It's not unusual to have good friends and neighbours in the apartment blocks. And sometimes we've actually moved into an apartment block where our friends or family are, so we can be closer to them. And so this is where we're seeing it moving, possibly somebody's getting into a lift with somebody, possibly people are using the shared laundromat together, possibly people are just popping next door to have a quick catch up and a chat. And that's why we're really asking people to be particularly careful if you do live in an apartment to make sure that if there's a lift going, that you are the only one in that lift, that if there is a laundromat or some shared facility that you have to use, that you're the only one in the room while that facility is being used, and that you keep to your own apartment as much as possible. Don't leave the door open to corridors and so on. Again, even if you're just doing something as taking food to the garbage chute, just make sure you're the only one in the corridor at the time. It can be difficult, but it is important.
Thank you, Dr. Jan. There's another question here from the Greek Herald. Minister Ward, has the government considered making the vaccine mandatory for families or essential workers?
Thank you. Yeah, look, we're always following the health advice, and at the moment it is as it is. I think that we're always considering the potential to keep people safe. But at the moment, we'd encourage everybody to just go and get the vaccine. If you care about, your families and your social environment and everywhere else that you are going to go, and if you want to be part of this pathway to freedom, as I say, please go and get the vaccine. Please encourage others to go and get it. And I just want to say to each of these organisations, thank you. It's so important that you convey those messages as well. The social distancing messages, the to get vaccinated messages. I'm very grateful, but it's so important we keep reiterating that, because when people get to know somebody that's had the vaccination, or they see a community leader, or they hear from their multicultural media outlets, go and get the vaccination, it's our best way out and it's the best way to stay safe, they will follow that advice, in my humble opinion. I can say it as a politician, but I'm sure if you hear it from someone that you know and trust, that you'll go ahead and do that. And it's unequivocal. If you get that vaccination, we will be able to get everybody safe. So I'd encourage everybody to do that regardless.
Thank you, Minister Ward. And unfortunately, we have run out of time, but would like to invite you again tomorrow for the Multicultural Media Online. And if you have any more questions, please list them down and have them ready for tomorrow. Tomorrow, Minister for Health, Brad Hazard, and Chief Health Officer, Dr. Carrie Chant, will be here tomorrow at 3:30 to 4 for information and questions that you may have. So thank you so much. I'd just like to ask Dr. Jan, do you have any last words for the media today?
Just thank you, everyone, for helping us keep the community safe. It's so important that we're all doing our part. So thank you for you doing your part, and always happy for feedback as to how we can do better, because, it's true. It's the media and it's the people understanding what we're asking of people that will really save lives in this pandemic. So thank you for the work that you're doing to keep people safe.
Thank you, Dr. Jan. As always, thank you for explaining everything. And Minister Ward, would you like to say any final words?
Absolutely. Thank you so much, Jess, once again, and Dr. Jan. And can I encourage each of you to please go ahead and apply for those multicultural media grants? They're there for you, to support you in partnering with us. It is critical that we keep getting those messages out. Please stay socially distanced. Please, if you care about people, keep your distance from them. And I know it's an unnatural thing to do. We all want to be together, and we will be again soon. Please go and get the vaccination. Encourage everybody you know to go and get the vaccination. Thank you very, very much for your attendance today and all your support.
Thank you very much, Minister Ward. And thank you to all of you who tuned in today. I know it's a busy time, but thank you for taking the time to send us your questions. And tomorrow we'll be back 3:30 to 4, and we'll send you the details. And if you want the recording of this online forum, they are on the New South Wales Multicultural Health website, and we'll send that through to you too. Thank you so much. Stay safe and take care.